Today I'm going to talk to you about the geriatric syndrome of falls. Falls is a circumstance defined as a common health condition associated with aging in the elderly. Risk factors for falls include older age, baseline cognitive impairment, baseline functional impairment, and impaired mobility. Even though falls is not an actual disease, it is still considered a geriatric syndrome because it is a common condition that is treated by geriatric physicians. Falls can account for extensive medical costs throughout the year. The CDC indicates that the average hospital cost for a fall injury is over $30,000. And in 2015, the medical costs for falls totaled more than $50 billion. As the population ages, the increase in the number of falls and the increase of cost will continue to grow annually. Falls are significant because it is one of the leading causes of disability in older adults. More than 1 out of 4 older people have falls each year, and once you have one fall, it doubles your chance of falling again. Falls are significant in nursing care because nurses are one of the key roles in ensuring quality and patient safety in nursing care. Nurses are a strong resource to mitigate and monitor patient risks because they spend the greatest amount of time with their patients. Nurses also maintain the skills to support effective patient treatment and recovery to ensure patient health. The patient used in my scenario for risk of falls was on multiple medications, one including Celebrex, which potentially caused myalgia in this patient, causing muscle pain and poor mobility. He was also on lisinopril, which can lower blood pressure and makes him at a potential risk for falls. The patient complained of all over muscle and joint pain of 2 out of 10. He denied any fevers, chills, night sweats, weight changes. He denied falls or trouble sleeping. Other symptoms to assess for this patient would be a prior fall history, balance disorders, and his medication history. Common complaints of patients at risk for falls include difficulties with walking or balance, lower body weakness, pain, vision problems, and home hazards. This patient that I assessed is at risk for falls due to his age, his muscle pain, and his thiazide use. He is also at risk for osteoporosis due to his low testicular hypofunction and poor diet. Objective data is very important for these patients at risk for falls because this is your chance to monitor what you would think the risk for falls is. He wore glasses, his gait was steady but slow, he had a little bit of weakness, and he needed assistance when rising from a seated position. Screening tools used on this patient were the Tenetti Gait and Balance Score, the Get Up and Go test, the Home Safety Assessment Checklist, which is what the patient answers about his own home, and then the mini mental state examination, which measures his cognitive function. Diagnosing this patient, and for all patients at risk for falls, include the screening tools which were used, again, the Tenetti Gait and Balance Scale, the Get Up and Go test, the MMSE, and the Home Safety Assessment Checklist. There is also imaging that you can do for patients that have fallen, but these tests aren't really indicative of patients that are at risk for falls. And again, it's X-ray, CT, and an MRI, which can identify an injury. Also, you can assess blood work for patients that can be contributing to falls, which would include testing for anemia, testing for myalgias, and testing for dehydration, things like that. Differential diagnosis would include syncope, seizure, stroke, vertebrobasilar insufficiency, and alcohol-related events. Even though these aren't differential diagnosis for falls, this is differential diagnosis for patients to look for in case they are at risk for falls. Even though this patient had not reported previous falls, he's still at risk for falls due to his muscle pain and his medication usage. So his treatment plan would focus on continual monitoring and prevention of falls. This patient should be assessed for pain, weakness, and previous falls at every office visit. He should have continuous medication monitoring. He could have blood work be drawn if indicated for anemia, for his poor diet and weakness. Also medication levels like a CK to diagnose myalgias. He would benefit from basic balance, strength, and endurance training. A vitamin D supplement may be indicated if his vitamin D levels are low, and this has been effective at reducing falls in older patients, and also decreasing his medication to see if his muscle pain resolves. The final diagnosis for this patient is drug-induced myopathy. The plan is to decrease the Lipitor to 40 milligrams daily to see if his muscle aches and myalgias resolve. Also check a CK level to assess this. And the challenge for this patient plan will be to maintain appropriate cholesterol and lipid levels since we are lowering his lipid lowering agent. Community resources that this patient could benefit from is physical therapy to improve strength, coordination, and balance, community services like the YMCA or other recreational group activities for seniors that have physical exercise classes. And also diet and nutrition counseling would benefit him to improve his diet. These community resources can help the patient find activities to do with other seniors to keep the patient occupied and social, and the therapies can assist with physical wellness and well-being. Health behaviors for this patient was poor diet and a sedentary lifestyle, and improving his physical health would be his overall goal. Social determinants included that he lived at home with his wife, but they are both elderly with no children. This can cause a potential problem, as they age and encounter more age-related health issues. The patient reported that he could afford his medication and indicated that he had no financial problems, but this should continue to be assessed also in case there is a need for assisted living or any other potential health needs that come up. So overall, the patient reported no problems except for myalgias. He's still at increased health risk due to polypharmacy, older age, and his sedentary lifestyle. Through the research, I learned that even though an older patient reports good health, his lifestyle and physical state should continually be monitored because of his increased age and his risk for geriatric syndromes.